Okay. So we said stimulants are drugs that stimulate the nervous system. Remember, we talked about their functions, right? Stimulants are mainly used for treating narcolepsy, attention deficit hyperactive disorder, attention deficit disorder, then also for short-term weight loss, okay, for treating obesity. So these are the main functions of stimulants. If you are being treated with stimulants, it should be mainly for one of these things, right? It is very easy to just retain it, right? Right. And we have three main classes. We talked about that. We have the anorexians, which are mainly to promote weight loss. We have the amphetamines, which increase norepinephrine and dopamine in the brain. Okay. Then we have some other modified forms of the medications that help to treat both narcolepsy and attention deficit. Okay. All right. Now let's look at the anorexians. Okay. Remember over here we are saying they are used to promote weight loss mainly. Okay. I mean mainly that's what we use it for. So you can most of the times questions will not even mention, especially when it comes to questions around these ones, will not mention the class. It will be like amphetamines. Okay. Um, most of the times they will just mention the name of the drug. So at least you can take note of um these drugs. Okay. You can take note of at least one or two of these drugs, even though um amphetamine is not an anorexiant. Okay. We are saying like it acts like amphetamines. Okay, that is indirect sympathomimetic. So when we talk about sympathomimetic, sympathomimetic activities, think of sympathetic nervous system. The flight and fight actions of the body. Okay, the neurotransmitter that facilitates the fight and flight activities of the body. So they are used to treat, we will look at examples very soon. Okay. They are used to treat narcolepsy, attention deficit, hyperactive disorder, and they are used to treat obesity too, like short term. Okay. And we are saying you have to take them 6 hours before bedtime to avoid insomnia. So after we've gone through all the classes, we will see that normally when we are ending it, we look at I normally pull out something that runs through them. Even if you can't memorize or you can't keep everything in detail, that's very thin. I mean those points that runs through all of them, you have to keep them. Okay. So that when you get questions around all these areas, you can be able to answer. Just imagine we are saying stimulant. They are stimulant, they stimulate you. So at least it makes sense. This one, you can associate it to all stimulants, not even only to anorexia, right? You have to take all stimulants some hours, okay, before bedtime. You don't have to take them at night when you're about to sleep. Otherwise, you will be very much awake throughout the entire night. It's going to disrupt your sleep, okay? So it's mostly, or it's best to take it in daytime or in the morning. So just take note. And contraindications, this one, hypersensitivity is like common contraindications almost every disease. So pay attention to the glaucoma too. I think glaucoma too is likely to run through all stimulants, right? Glaucoma, cardiac disease, hyperthyroidism, then children below 12 years, and if you have history of drug abuse. The side effects is restlessness. Of course, it keeps you awake. It can, it can make you restless. And insomnia, it will not let you have a good sleep, especially when you take it at night. Sometimes even daytime, like taking it daytime can even have, can even have insomnia on you at night. It's possible as its side or adverse effect. Okay? Then you can get palpitation. So all those high things, palpitation, tachycardia. Okay. Decrease seizure threshold, dysmenorrhea. All right. So um, these are side effects. Nursing considerations: you have to monitor your blood pressure and pulse because they're likely to go up. Then adjust, sorry, adjust antihypertensives or antidiabetic medications as needed. So antihypertensives, especially if you are taking stimulant, they're likely to make everything go up, right? So if that is so, if you are taking antihypertensives, they can make them ineffective. Okay. When you are taking stimulant and antihypertensive like all around the same time, that is why we have to we have to take note of it. Okay. Then the next one is evaluate therapeutic response. That's weight loss over time. We are saying it is used to treat obesity. Okay, it is used to treat obesity. So if you don't um, modify or the dosage, okay, I mean not you. If the dosage is not being modified by your healthcare provider, or if you are the nurse taking care of this patient, you have to keep an eye on the patient weight, okay, and report if there is too much or maybe out of range or out of goal weight loss. Okay, if there is out of goal weight loss, then you can report to the healthcare provider. All right. Clear chain, avoid driving until the effect is known because this stimulants can cause anything. Right. It can make you very hyperactive. You don't know how you will respond to this medication. Okay. You can get palpitation, can be restless, can have lots of things happening. So discuss all for this one too, it runs like through all medications almost. Okay. Discuss all over the counter medications or prescriptions with your prescriber if you are on this medication. Any question on this slide?
Boss,
Yes.
with the side effect, the decreased seizure threshold, does it mean it prevents seizures or it reduces, it increases seizures? Which one?
It decreased seizure threshold. Um, Seizure threshold, like for my understanding, I think it brings it down.
Yes, that's
That's
what
how I
I'm
understand
thinking.
it. Yeah,
I
that's
want to
also
be sure.
yeah, that is it.
But I'm asking
Okay.
because it is a stimulant. So how it does that?
Yeah, that's what.
Yeah, how it does this. I'm trying to link it with anti-diabetics medication. Well, you know, let me see if maybe I can link it. I thought someone would even ask for this. So one thing about seizures is that um wait, let me get this one clear. It says what decrease seizure threshold. Um well, I'm trying to link up with this one. If anyone has any bright idea how it works to decrease the threshold, the person can bring it out the first place. If anything, it will rather decrease it. It will not rather make it um make it worse. But how it does that? That is a tricky part. If anyone has any idea of how it does that, the person can bring it up. I am think you see, let me try and link what I know to this one, if maybe it will make sense. With anti-diabetic medications, stimulant is capable of masking um, hypoglycemia symptoms, that, like that, shakiness, and all of that. It's capable of doing that. So, anti-diabetic, I mean, hypoglycemia, shakiness is also different from seizures. So that is a tricky one anyway. If anyone knows, the person can let us know how it does that. If not, then maybe we can all search for it so that um, we get to know. Okay. All right. Any other question? If I'm able to find it, so I'll share it with all of you before we close. So, all
And
right.
and the anorexia,
Yeah.
the name anorexians, does it mean that it's it makes you, I mean, not to feel for food or something? Like it reduces appetite.
They are anorexians reduce.
And linking it to the weight loss.
Okay. Yes. So
I'm asking if
anorexia.
was linking it to the weight loss.
Yes. Yes. Anorexia is like like feeling how do you call it? Like what's the simple way to even describe anorexia? Like not having the urge to
Loss
eat,
of
right?
appetite. Loss of
Loss
appetite.
of appetite, yes. So not good. Loss of appetite or not having the urge to eat. So they have that effect to cause or to stimulate or to play with, let's say, not new my words are not coming, neurotransmitters. Okay. They have tendency to play with neurotransmitters in a way to cause you not to feel hunger. So they put you in a position of like being like anorexia, okay, like losing appetite. So that is how it will act to cause your weight loss. Okay. So anorexia is loss of appetite. It will let you lose appetite in a way to help you reduce weight. So all those on these medications, I think we have examples on the next page. They can let you have anorexia. Okay. And apart from letting you have the anorexia effect, they have other benefits so that
People
it
buy
can
like
play.
thousand plus.
Okay, like narcolepsy, after all the anorexia parts, it will keep you awake. Sorry, yes, it will keep you awake. Narcolepsy is like daytime sleepiness, right? So it will keep you awake. That's how come it can help solve this issue. Then if you are not attentive and you are very hyperactive, it will also kick in. to help. Then with the anorexian part, I mean, letting you lose appetite, that will also help check your weight, okay, and let you lose weight. That's why it is also used to treat obesity. Are you clear? Any other question?
Yes, please.
Yes, please. I have a question. My question
Okay,
is the contraindications, right? The glaucoma. Can you
the
explain?
glaucoma.
Yes, yes. Can you explain why it is contraindicated?
Okay, so one, especially with the close angle glaucoma, most of these stimulants are, I mean, they are, we have different types of glaucoma, but some, whether you see glaucoma alone or close angle glaucoma, this one, like I told you, it's like it runs through all the stimulants. Okay, they make the glaucoma worse. Okay, remember, glaucoma is it's like hypertension in the eyes, high blood pressure in the eyes, and
Increase
these medications,
intraocular pressure.
yes, intraocular pressure is hypertension, like it's like blood pressure in the eye, high blood pressure in the eye. Okay, so to the layman person, stimulants will increase your blood pressure generally, systemically, everywhere. Okay, so when you already have glaucoma and you take stimulants, it means you are increasing the pressure in your eyes, which is intraocular pressure, and it will make glaucoma worse. So this one, it runs through all the types of stimulants. Please, do you understand it?
Yes, I do.
Mm-hmm.
I'm just the ADHD, that is attention deficit, if I'm right. And how is this person? Okay, yeah, sorry, I'm okay.
You are okay now?
Yes, yes.
Yeah, I think, yeah. If I was about to get your question, I think someone even asked it last week that the person is already hyperactive. So how
Mm-hmm.
do you give this medication? Was that your question?
Yeah.
Uh-huh. Yeah. So I think last week this question came up. Yeah. So um this person doesn't pay I mean, it's like his attention is not focused, okay, with
It's
ADHD.
organized
That
percent.
is someone saying something? The hyperactivity is not a focused one, okay, but this drug can make it like can treat it and make it more like it can make whoever that has this condition focus and pay attention to details. Okay, that is why it is used for that. So it's not like it will just make, because it's stimulant, it will just make you go like up and like you'll be all over. It doesn't work that way. It helps you to focus more. All right. Any other question?
Yes,
All
please.
right.
I have a question. Yes.
Okay. What's your
Hello.
question? Yes, I'm
Yeah.
here.
Please. Yeah. Can you hear me?
Yes, please, I can hear you.
Okay, please. My question is on the nursing consideration. Please, where you said are just antihypertensives. So I want to understand the kind of adjustment. Is it to reduce the dosage or just simply maybe you don't administer them at the same time? So I want at the same time I want to get the understanding. Thank you.
Okay. Okay. So antihypertensives, they bring your blood pressures down. Okay. So let's say if you are hypertensive and you are also taking any stimulants. Okay. Stimulants side effects are likely to send your blood pressures up. Okay. So if let's say you are hypertensive and you are on 30 milligrams like Nefecad, which is like nifedipine, and you are also taking stimulants, the 30 milligrams is likely not to work to bring your blood pressure down because there is already another drug which is stimulant, which is sending your blood pressures up, 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 up. So um in questions, right? In questions, if you get okay, let me explain it before maybe I link to questions. So what it means is that you will need higher doses if you are on stimulants because stimulants already sending your blood pressures up. And you, if you are, let's say, also taking antihypertensives, it means you will need more of the antihypertensives to um to help curb your blood pressures down. Okay, compared to someone who is not taking stimulant. If you're not taking stimulant, it is the antihypertensive. I mean, the antihypertensive medication will have its own effects on the blood pressures. But this one, you have something already pushing the blood pressures up, and you, let's say, if you are taking antihypertensive, which is let's say about a lower dose already. Okay, or it could be that you were taking the antihypertensives before you started the stimulant. What it means is that when the stimulant kicks in, your blood pressures might not be able to come down because as the antihypertensive is bringing the blood pressure down, you have the stimulant pushing it more up. So if that's why we are saying if you are taking any medications, you have to let your healthcare provider know so that adjustments can be made. So it may be instead of 30 milligrams, they could give you 40. Okay. And most blood pressure medications, they are not like KYD or TDS or something. Most of the times they are BD or daily, either BD or daily. So it means they stay in the system for long. Stimulant too, they stay in the system for long. So they are going to be in competition throughout the entire day. Okay, they're going to be in competition throughout the entire day. So proper adjustments will have to be made to the dosages, especially the antihypertensive. I don't know if you understand what I've said. Do you understand it, or you don't still understand it?
Oh, I understand it now. Thank you.
You're welcome. Any other question?
Sergia,
Okay. Yes.
please, I have something to say about the decreased seizure threshold.
Good. Someone has found something. Okay.
Okay, so I found out that the meaning is not literal because it has decreased seizure threshold. That means that a lower seizure, no. What I
Okay.
found was that because it has a decreased seizure, having a decreased seizure threshold means that you are more at risk of getting the seizure compared to a person who has an increased seizure threshold.
Oh, okay. Wow. Yeah. Yeah. Okay. Yeah, it makes sense. It makes sense. So
So the
it's not
stimulants are
it's
being
not likely to
My
cause seizure.
boss, my
yeah,
hand
it's
has
not
been asked
likely.
to contribute to
You're
that,
more
but it
likely
didn't
to
fall.
get seizure.
Okay. Oh, sorry, Jacob, I didn't see your hand. So it's not likely to cause
Uh,
seizure. Yeah. Yeah.
it's the same thing I wanted to contribute to earlier on.
Oh,
Because
I didn't see your hand.
like you
Sorry.
said,
Mm-hmm.
so to add a little to that, when you say the threshold is decreased, it's like when you have a benchmark for something to be, let's say, 100. You are saying they are decreasing the benchmark. It's like you are bringing it now to 50 so that more people can cross the benchmark. So
Yeah.
if the threshold of seizure is decreased, it means that with little trigger, you get seizure.
Yeah.
The person who
Yeah.
ordinarily would not have gotten seizure will now get seizure with a little trigger.
Yeah. Yeah. I get it. Yeah. That is true. That is true. Thank you for your contribution. I missed this one, right? Yeah. So we have more scholars here. That is good. I missed that one. Thank you for bringing that up. I hope we are all on the same page. Do we all get it?
Yes, sir.
Good. So, it is not likely to cause seizure. Good. Thank you. All right. Any other question on this slide? All right. So these are some of the examples. Okay. Pentamin. I don't know how you pronounce it, but I wish I can give you a trick to keep this, but at least you can picture them when you see them. Maybe you remember. Because sometimes when I'm learning to, I'm going through some of these things, I'm like, how can how can I make it easy for people to capture this? But if you are lucky, you get pens, vitamin, at least you remember vitamin, right? That is a stimulant. So, but what about the other? And this one, at least 10 men. But the other ones, yeah. So these are examples of anorexia. Okay. All right. Just to let you know. Now the second one. So let me show you something here. You see, we made mention of three classes. We've talked about anorexians, right? Which are mainly used to promote weight loss. As someone asked the question, is it like the person asked whether it comes from the word anorexia? So it has a similar play. Okay, it keeps you away from food and in a way will help you reduce weight loss. But remember, we said stimulant has the tendency of causing or of treating all these things we've listed down here. So even aside the weight loss, it can help treat all these things like we've gone through right now. Okay. But they are mainly used if we want to reduce weight. That is where we use it more. Okay. Now the second one we are going to talk about is amphetamine. This one is the most commonest ones. Okay, that you see in question banks and all over. Okay. All right. So now let's talk about amphetamines. How amphetamines work, they increase norepinephrine and dopamine in the cerebral cortex. So, like we mentioned, it is used to solve issues of epilepsy, attention deficit hyperactive disorder, and diabetes, obesity, okay, and obesity. So you see this one too. Don't take it closer to bedtime. All right. So this one to runs through the whole thing, like for all stimulants, like we said. All right, because of insomnia. Then you have to take it on empty stomach. All right, so that is 30 minutes before, 30 minutes to 1 hour before meals. Most of the times, drugs that should not be mixed with food, they are either 1 hour before meals or 2 hours after meals, more than 2 hours after, something like that, so that you don't have the whole thing mixing with food to reduce its efficacy. Okay, it's like first pass effect. Those of us who have heard those things, I mean, that said before. To reduce, we have a lot of areas where you can have first pass effect happening. That's it's one part, right? Contraindications, hypersensitivity is part, hyperthyroidism is part, hypertension. So you see, if your blood pressure is, or you are dealing with issues with blood pressure. So let us take notes. Over here, we have stated some of them. But should you get any question, Okay. Should you get any question, and let's say if the person's blood pressure is high, or the condition is associated with high blood pressure, please, it is still this medication will still be contraindicated in it. Okay. Let me give you an example. Let's say you have someone who has, of course, when someone has ICP, like increased ICP, I don't know what will even make us even use stimulant in the first place. But I'm just giving you a rough example. Okay. Someone who already has increased ICP, you would not want to give any medication that will raise the blood pressure more. Okay. Anyone who has portal hypertension, that is with the portal system, or pulmonary hypertension, that's with the lungs, like anything that um, has to do with high blood pressure. Okay. Um, what's the name of this condition? Let's say adrenal, if you have adrenal crisis, okay. Adrenal crisis will send your blood pressures up to. Okay. So just imagine someone with adrenal crisis, like, you know, taking stimulants to make the whole thing worse. Okay, so that's how I want you to think. Okay, I'm just drawing your attention. When you get a condition, understand it, and understand the kind of medication you are. They are asking you whether it's safe or not. All right, any question here? If not, we look at some of the side effects. So you see hyperactivity, insomnia, restlessness, palpitations, tachycardia, dry mouth, then libido changes. It makes you hyperactive in a way that you will not even concentrate to have your libido in peace. Okay. That's just by the way. But do you know that you remember stimulants work in the like it's work in an antagonist way of sympathetic nervous system. Okay. Like in an agonist way, not an antagonist. It works in an agonist way of, like, it works in favor or in the same line with sympathetic nervous system. That's how it works. And when uh, you are hyperactive, or when sympathetic nervous actions are in place, you don't even have time for erection and all of that. Okay. Yeah. So it's when I think parasympathetic nervous system controls that aspect rather. Okay. Controls libido, erection, and make all those things. So it's like that. If you understand sympathetic and parasympathetic nervous actions, you can link it to it. Okay. All right. So you can see all these changes here. They are all like sympathetic nervous actions. Right. Everything goes up, high, high, high. So nursing considerations: monitor blood pressure, complete blood counts, urinalysis, okay, blood glucose in diabetes, because they can mask the um, the effect of hypoglycemia. You not see before you realize patient is already gone. Okay, all right. Then the next one is assess mental status. That's mood, sensorium, aggression. Okay, you should watch out for aggression too. And the next one is watch out for withdrawal. Okay, as you give it, watch out for withdrawal, because um the withdrawal symptoms, right? The withdrawal symptoms of herpes will make you calm down. Okay, so you see weakness, then there could be headache, nausea, and vomiting, and all of that. When patients are on stimulants, especially amphetamines, for ensuring proper rest, I think it runs through all of them. Okay, it runs through all of them. Then we are also saying avoid caffeine and all of these things. So take note, all these things contain stimulants: coffee, tea, cola, chocolate. All right. And I think questions are very common on these areas. I've seen questions on this one before. Okay. Do not encourage tea. For coffee, many people are aware of coffee. So they can sometimes, especially tea. Tea is a tricky one. Even chocolate, okay. So take note of these four items here. They contain and caffeine, of course. Okay, if they mention caffeine right away, so you should know. So all these have some stimulants in them. So they are going to make you worse if you are taking amphetamine. Never forget this. All right, any question here? Okay, so these are examples. Okay, and for the amphetamines, you see vitamin, and then them. So that's the easiest one to put. Okay, except maybe only this one. That is very difficult. But you are likely to get all those ones that any vitamin. So you will know it is amphetamine, a stimulant. Okay. So what are the main things we use stimulants to treat? Can we all repeat them? We used to treat what and what? There are four things. What are they? What are the four things we use stimulant to treat?
Narcolepsy,
Narcolepsy,
ADHD,
ADHD.
weight loss.
And the last thing.
I don't remember.
Okay. So ADHD or
ADD.
ADD. Okay, I mean the same. So it's like
ADD.
they are still attention deficit. Okay, yeah. So that is it. All right. So that is what we have here. Okay. So we have specific ones here and what they are used to treat. Okay, right here. All right. And please, when you get questions, when like let's say should you get questions on the NCLEX, they are not going to ask you anything like elective pharmacology. Okay. They are going to ask you about the nursing aspect. So that is where most of the times my key uh, my key focus is.
Your
Okay.
focus. Mhm.
Those of you who have gone far in your preparations, you can attest to what I'm saying. They are not interested in, like, you should know what they do. And the NCLEX is a safe exam, like safety exam. Okay. So when one is taking this, what should the person not take? Like something for the person to stay safe whilst on that medication. So if you know what it does, okay, you know in how to protect your patient. But every drug has a serious, the targeted effect, how it's been absorbed, and all of that. There are things that pharmacists, actual pharmacists, learn. Okay, yes, we shouldn't worry ourselves. Just know they are, what they are used for, and the safety aspect. Okay, those of you who have done pharmacology can attest to it. Okay, when one is taking this medication, how should the person take it? When should the person take it? With what? Okay, what should the person avoid? So it's like all about safety, safety, safety. So try and focus on those areas. Okay, so these are other, so the last aspect of it, the other medications that are used to treat narcolepsy and attention deficit hyperactive disorder. We have this one. Okay, so these are the medications. Okay, I think I brought this one here to help us like summarize. At least you remember what I told you. Like I normally bring up something that runs through all of them. Okay, to look at this one, the first aspect on the left hand side here, they affect norepinephrine and dopamine to improve alertness and attention and focus. Okay, so it is not just making you hyperactive. Okay, it's also improving your alertness, attention, and focus. That is how it works. Okay, and administer it at least 6 hours or more ahead of bedtime. Okay, so if they give you a practical question that maybe they can make the question look or appear nicer. Okay, if you are giving it to, let's say, a 15-year-old, maybe teenager, or a 14-year-old teenager, and the person tells you maybe I can take it in the evening so that so they'll be like which of the following statements, okay, or which of the following teachings will require further action by the nurse. Okay, or which of the following, let me say statements. Which of the following statements, a patient is taking, let's say a 14-year-old boy is taking now amphetamine. Okay. Which of the following statements will require the need for further teaching? Then the child will be like, or let's say the teenager will be like, one, I can take my medication after school or maybe in the evening when I am free at home so that I never miss any dose. Okay, I can take my medication in the evening when I'm at home so that I never miss any dose. You see these statements like this, it looks very, very, very nice and it sounds good because no one will want to miss any dose. But this sentence is wrong because in the evening, no matter the time in the evening, it's wrong to take amphetamine. So looking at the hours, 6 hours. So if your evening is starting around 4, 5, or 6, you are still going to be caught up. Okay. So wrong questions will always come in a nice way, already wrapped for you. And you should be able to fish it out. Okay. Even though it's good not to miss medication, but taking amphetamines is not good. So just be aware. The next one here, contraindications, is also runs through all of them. Okay. Tourette's syndrome. Do you know Tourette's syndrome? Who knows
Yeah,
Tourette's syndrome?
I have an idea.
Okay. Have you seen it? Have you seen it
Uh,
in like as a separate condition before?
no,
Yeah.
I've watched a documentary on it before.
Oh, okay. So it's all about
Yeah,
what?
it's like involuntary. They are
Yes,
involuntary
involuntary like
movements,
text.
so
Good,
yeah, it makes them like kind of have movements, hand movements, uncontrollable hand movements, and
good.
they are involuntary.
Jerky.
So when it happens like that, they can't talk. Yeah,
Good,
they jerk.
good,
Yeah.
good, good, good. So if you have Tourette syndrome, so this is also a new thing. I mean, one thing to add. Okay, if you have Tourette syndrome, it can affect like how our sister is saying, motor movement anywhere, not only your hand. Okay, you can even have your whole head jerking. Okay, your hand can be. I mean, it's like that. jerking, your vocal cords can even be like it can affect every place. Okay. So the
Hello,
easiest
sir.
way they used to, yeah.
Yes, so the first syndrome it affects children with ADHD and autism spectrum. They have this repetitive screaming. It's like tics. They can at times scream, then they'll stop, then they'll scream, then they have this hand movement. It's a repetitive act that they do. So it's for ADHD and autism spectrum children.
Okay. Okay. All right. Thank you very much. All right. So yeah. So even if you forget about Tourette syndrome, think of it as text, like okay, like repetitive checking movement. It can be other things to include it, but just to let you know. So when someone has this, you can't give the test. Okay, it will make the symptoms worse. Remember, the thing is uplifting everything. It will make the jerky movement and all the ticks worse. Okay. Glaucoma, as we talked about already, it will make your biocular pressure worse, and your eye medications will not even work. Okay, look at this very well. You can give it to children under 6 years. Stimulant. Don't give it to children under 6 years. Okay. Side effects, irritability, headache. So you see, some side effects are or some signs and symptoms are just vague. You see, when you are withdrawing, you can have headache. Okay, and when you are intoxicated or you are overdosed, you can still have headache. Do you know that even acetaminophen? Do you know that acetaminophen's side effect is headache? Have you seen it before? Acetaminophen, which is used to treat headache, the side effect is also headache.
Yes,
No.
I know that.
Mm.
Yeah, you can search for it. Like they are there like that. Okay, so sometimes the things are it is what it is. Yeah. So and there is a mechanism why it happens. You're not interested in that. Dizziness can cause drowsiness, insomnia, nausea. All right. So these are the other medications that are used to treat. I think I should have separated this one. I don't know why I brought it here. So these are the other medications for narcolepsy and attention deficit hyperactive disorder. Um, just in case you don't see the amphetamines, okay? We have some. So these ones, okay, they are used to treat attention deficit hyperactive disorder, but they are not stimulants. Okay, atomoxetine, guanfacine, and clonidine. Okay, so when you have a patient, let's say a chronic hypertension, let's say hypertensive patient with let's say narcolepsy or ADH, and you want to treat, these ones will be your ideal drugs. Any of these, okay? Any of these will be your ideal drugs instead of going for amphetamine because they will get the work done, but they will not what stimulate you and send everything up. Okay, so that is it. Yeah, so we are saying especially if stimulant is not tolerated, yeah, and they have less abuse potential. Okay, many people would even want to take stimulant because of the high effects they get, but these ones, you know, they have less abuse potential. Okay. Then we have other drugs for narcolepsy too. Here are they. Okay, modafinil, and sodium oxybate. So this one too, they help promote wakefulness and reduce cataplexy. Okay. All right. Any other questions? So you can take this. Clonidine, I think clonidine is very common among our, our learning, right? Who has done pharmacology and hasn't seen clonidine before? Even if you've not seen clonidine before, you've seen clonidine patch before, right? Haven't you heard of it before?
Yes.
Yeah. So ato
Mm, yes,
atomoxetine,
sir.
yeah.
With clonidine, the other name for it is cataphrase, and
Um, can you
it
spell it for
it
us?
has this side effect of cataphrase. It's CATPRES, cataphrase.
Okay. Is it like a trade name or a generic name?
No, the clonidine is a generic name, so it's
Okay, so what you are
a
saying is a
trade name.
trade name. Okay. All right.
Yeah. So
Okay.
it also has this side effects of constipation.
Oh
So
yeah.
if a patient a chronic diarrhea that cannot be treated with other medication, it's also used to treat.
Okay. Okay.
Yes.
All right. Thank you very much.
Please, there's this medication for the ADs. There's another called the methylphenidate. Uh,
I think I mentioned it here.
uh,
Wait, I'm coming. Let
oh,
me see. Let me take my slide back. Let me see. Oh, what did you say? Did you say methamphetamine or methylphenidate?
methylphenidate.
Okay, let me see. I saw it somewhere. I don't know whether I captured it. Let me see. Oh, so I didn't bring it here. Yeah, so it's also a stimulant. Okay, it's also a stimulant. So I think that one is in your notes, right? It's in your the note that we've given you. I didn't capture it here. Methylphenidate. Let's see.
Clonidine, is it the same drug that is used to treat
The other
hypertension?
is Ritalin.
Come in.
I said the clonidine, is it the same drug that is used to treat hypertension?
Um, yes, it's the same thing.
Okay.
Yes, it's the same thing. Clonidine. So whether the patch or yes, so it's the same thing.
Okay.
Yeah.
But yeah,
Yes, sister.
please, I'm struggling to understand the 6 hours before bedtime. Because if I should get your point, this medication is the medication keeps you awake, so you don't have to administer it close to bedtime. So why am I seeing greater than 6 hours? Please, I don't understand that aspect, please.
Okay, let me take you back here, right? Administer the medication greater than or equal to 6 hours before bedtime. Before bedtime. So if you don't understand it like word for word here, 6 hours greater than or before. what are 6 hours greater than or equal to? Like, let's say when you say something is greater than or equal to 6, it means it could be 7 hours, 8 hours. Like it starts from 6 hours, right? So 6 hours,
Yes.
7 hours, 8 hours, and more. Okay, so it's like administer the medication either 6 hours, 7 hours, 8 hours, or more. Okay, before your bedtime. Okay,
Okay, so
so mhm,
if I can change it to my own understanding, administer less than 6 hours before time, before
not
bedtime. Is it the same thing?
no,
More than six
no,
hours before time.
more than six
It's more than
hours
6 hours.
before bedtime, not less than 6 hours before
More
Wow.
bedtime.
than
When you say administer
Come
it
back home.
less than 6 hours before bedtime, it means you can even administer it 1 hour to bedtime, which is wrong, according to what you are saying. Okay, so before you sleep, let me bring it down. Before you sleep, make sure that the time that you take it would not be between um anywhere within 6 hours to the time that you sleep. Let it be more than 6 hours when you take the medication before you sleep.
Okay, I think it makes sense now. Okay.
Yeah, so
Uh,
it's the same thing, okay, but it's written in different way.
Okay, okay, thank you.
You're welcome. Any other question? Yeah, so what our brother said, methyl I think I didn't capture it here. So I think I rather wrote methamphenidate. That is one. Wait, wait. Yeah, methamphetamine rather. So methamphetamine is there, but methylphenidate is also a stimulant that also works perfectly to control ADHD and narcolepsy and weight loss. Any other question? I'm writing it here so that you can see. If you have any question, you can ask. Pass with wait. Methylphenidate.
So it's the other name is Ritalin.
Another name for this one.
Yes, it's Ritalin.
Oh, okay. Over here, many nurses like mentioning the trade name, but for English sake and for everything, if even if you can keep anything, keep the generic name, okay? Because the generic name will always be there. But the trade name, if let's say for a particular drug, they give you another trade name, which is not maybe popular to you, you are going to find yourself once. So
I'm saying this
uh,
one they always add they write
they always add it. Okay,
sulfonyl stroke. Yes,
okay,
sulfonyl stroke Ritalin.
yes, okay. But those of us who can keep both of them, that is fine. It's always good to add up knowledge, okay? But if you think it's the names are becoming plenty, and you want to choose one, okay? So this is conditional. Like if you want to choose one, it's always better to choose the generic name, okay, than the trade names. If you want to choose one. All right. Any question? If not, then we can carry on. So now let's look at this part. Okay, so we have I think we've talked about it already, right? I don't think we should look at it again. Or monitor vital signs, blood pressures. We talked about all of these things. So let's look at this part. At least when you look at stimulants, okay, stimulants stimulate you. So this is something maybe just to help with it, like a memory trick, okay, with the side effects of stimulants, what they do. So the first one is what? Sleep problems, which is what? Insomnia. The T is what? Tachycardia. I is increased blood pressure. M is malnutrition. Okay. You lose appetite, and if you're not eating, you'll be malnourished and you lose weight. Okay. The U is what? Upset. It makes you upset or irritable. So low appetite, we thought about it. Then it is used for what? Stimulant is used for attention deficit hyperactive disorder treatment. Then tics can worsen if you have tics. So this is like a contraindication. Then it can make you euphoric. Stimulants can make you euphoric. So it causes euphoria. Just a memory trick. If you have any question, the questions around this is not too difficult because if you grab the concept, you know what it does, you know the contraindications, there's no question you can get for it around this series. If you have any question, you can ask before I start asking you more. Can I get a reader? Someone should take it for us. The first question.
The nurse administering
Carry on.
methylphenidate is monitoring the client for side effects associated with its medication, which assessment finding with the nurse disregarded as
Okay, hold
unrelated
on.
to this medication.
Hold on. So, was it Franklin? You see, I included it in my question, but I never brought it there. You see it. Later finish it. All right, carry on. Where's my reader?
Um, so which assessment finding would the nurse disregard as unrelated to this medication? One, insomnia. Two, fever. Three, rash. Four, palpitation.
So, what's the answer? Very easy. Please, if you are here, get some correct, okay? Because
Insomnia. Ross,
It
number
says that it's rash, unrelated. It means it's not part to this
hey,
medicine.
someone is getting this
And
question wrong.
rush.
It's rash.
Like, see.
Right.
So, what are we all choosing?
Rash. Because it's
I'll
not
go for
part.
rush.
Rush.
Right.
All right. Well, I'm not saying it's correct or wrong, but let me see. Efia Rosita, are you sure rash is the correct answer?
Yes, I'm 100%.
Yeah, what? I can hear you well.
100% rush.
Hey, Mrs. Bedu.
I'll go for fever.
You go for fever, eh? Oh, the person don't have him. Someone said she will go for fever.
Was
Aduma.
just confused.
Oh, oh. This thing, if you know, you know. If you don't know, you don't know. No matter who is confusing you. Methyl we spoke about it. It is a stimulant. So just imagine how stimulants work. That's how your English day is going to be. You're not going to see everything like detail. Okay, that's why sometimes we try to bring some the form of question. So that when we see how we can apply. So looking at how stimulants work, which one do you think is unrelated?
It's a
Rush.
rush.
Number three.
Yes, I think it's number 3. Those of you who are changing your answers in your mind, you know yourselves. Okay. Yeah, have a reason and like a backing for your answer. There's no reason why you should choose um rush as the answer. Now let there be silence. And there was what?
Wow.
Now, is it the person that's run away?
So boss,
Yes, was.
yes, indeed, we can say that hypersensitivity reaction is also a rash. However, we are also being told that stimulant increases almost everything. So,
Yes.
isn't there? Don't you think there's a probability that stimulant can also cause hypothermia or a high body temperature or fever?
Really?
Okay. All right. Let me break this down.
Yes.
Okay.
Yes. I'm reasoning with my brother there because even if you have never seen it and you look at the mechanism, it says that it increases everything. So if everything increases, then your body temperature is also likely to increase. So in a way, it makes sense.
And it's even
However, what the person
contraindicated
says
in
to say,
people with hyperthyroidism.
Let me what you are saying is 100% correct. Let me take you back to the question and let us see something. The nurse is administering methylphenidate. Sorry, the nurse administering methylphenidate is monitoring the client for side effects associated with this medication. So look at the second part. Which assessment finding would the nurse disregard? Which one would you not look concerned, or which one would it not be concerned for you as unrelated to the medication? When
so with if you look at what you have learned so
wait,
far,
wait, wait, wait,
the
wait,
one
wait.
that the one that you should be thinking to disregard
This,
to me, uh,
this question,
the rest because
before I got it, I know it was tricky, but uh, later I endorsed it. That's why I brought it. Okay.
so the question says
Disregard.
what it is, so we follow it.
No, I want us to look at something here. Which finding would the nurse disregard? When you see fever, methylphenidate directly, um, well, it does not cause fever. Okay, listen to this one very well. I think I can make it more easier for us. Methylphenidate on its own, it does not cause fever. Even though everything goes up, it is likely, but it's not one thing about it. When you take methylphenidate or any drug and you get a rash, it is something that you can disregard. That is how I understood it before I brought it. It is
Oh yeah.
something that you should disregard. It means something is happening, which could be a reaction. Okay. This one, you can't disregard because palpitation is part of it. Insomnia, we know you can't disregard. Okay. That's why it's a tricky one. Okay. When you disregard rash as unrelated to the medication, that means you are missing out a possible maybe Steven Johnson syndrome or a reaction. Okay, do you get it? That is why you should not disregard this one. Any medication
Yeah,
should not
yeah, the work.
disregard rash. It is not saying
That's what I'll come
as
to.
part of okay. So
Because
that's how
even
I
any other
understood it. That's how I
medication, if
wrote
you
it.
take, I'm also understanding it from that regard now. Any medication, if it's not even medicine, because once it's still a rough, it means there is some kind of hypersensitivity and reaction. So you should be concerned.
Yes, it will be a concept. Okay. So the choice of the words, okay, that are being used. Please don't belittle this person. Okay. I saw it and I wrote it. Don't belittle this person. Fever. So you see, I don't know, someone can search it and see. Fever, you can't take fever directly out of maybe the side effect. But even if it will cause, it's very, very indirect. Like it has a long pathway before, even if there will be fever. Okay. But this one you know it is there, this one you know it is there. Rash, you can disregard rash. So the answer becomes fever. Where is our nurse? I mean, our nurse who chose fever, and she later ran away because
Yes,
we
I
all
was here.
endorse what?
So
Because we all
I
endorse
know that
rash.
the stimulant, it stimulates the body, but it actually doesn't cause fever. It's not the side effect of stimulant, the fever.
Okay, okay,
Yes.
yes, of course. Yes. So the answer is fever. I wish I have similar. I wish I have similar
Boss
questions. So
dear,
look at the Rashid. Yes,
boss
sister. You
dear,
can raise up your
please,
hand
please.
if you have any question.
Okay, please. Why will you disregard fever?
Yes.
Fever is serious, oh.
Okay.
Why will you disregard?
Fever is
Yes,
serious. Wait, fever is serious. Did you wait? Oh, listen to what I was saying. Fever is serious, but is it related to the stimulants that we are talking about? Is it related to methylphenidate? You know, when we were doing the downers, let's say we met carbamazepine, right? We met that drug. Do you remember that we said you have to do weekly WBC and the rest? Do you remember? If
yes.
Yeah, due
okay,
to
if
blood
this medication
discretions.
happens to be that it is related, but this is stimulant. Stimulant fever is directly not related to stimulant. Okay, like I'm saying, it will have a long pathway before. It is not generally a side effect of what methylphenidate or stimulant. It's not a direct something that normally comes. Okay, that is why. So the why so you see everything was between 2 and 3. So why 2 was chosen over 3 was that the question said, unless you understand what the question is saying, okay, it's not. I know some people are understanding it in different way. Look at the question again. So you answer the question in a way that the question is asking, not what you think it is. Which assessment finding would the nurse disregard? Something that you would disregard as not related to this medication when you are administering it. So let's say when you're administering it and the patient gets rash, will you just rubbish it? Or will you just think that it cannot be associated with the methylphenidate? I'm asking a general question. Because when the person is not sleeping, you will know that yes, I mean stimulants can cause insomnia, so it's related. That is easy to spot. When patient is having palpitation, you can spot it. That's easy to spot. When the patient has rash, it is not a normal side effect, though. But the word which was used here was, would the nurse disregard? Will you disregard a rash when you administer this medication, the patient did not have a rash, but when you administered it, the patient had a rash. Is it not easy for you to associate it to the drug that maybe the person is maybe the person is allergic to it? That is what the question is asking. Fever is directly not related to methylphenidate. Or you still don't get it? Is it getting better?
Bosdia,
Yes, sir.
Yes.
sorry, I just want to share an experience that I had with this medication with you, so that at least we all get to know that fever is the answer. A sister of mine whose son had this condition, this ADHD condition. So they prescribed this methylphenidate for the boy, but unfortunately we couldn't get the dosage. The boy was under 6 years. I think that time the boy was around 5 years. So we couldn't get the right dosage. But then they convinced us that, we should just give some amount. So my sister did all right. And then the following day, this boy had rashes all over his body. So we have to return the medication to one hospital nearby so that their pharmacist can prepare it into a syrup for us so that we can at least calculate and give him the right dosage before the rashes subside. So I think rash is connected
Good.
to this methylphenidate medicine.
So you
Yes.
have even a direct. So fine. When good. Let me
Resume the
continue
amount.
from where
Glasses
you
system.
ended. So when you gave it and there was a rash, did you disregard
Yeah.
it?
No, we didn't disregard it.
And you associated it with the drug, didn't you?
Yes.
So the word here, please, when you go to the case, pay attention to the wordings.
Yes.
Disregard. It didn't say it was like will be a side effect. Okay.
Yes.
If the question maybe was like which finding would the nurse identify as maybe a side effect related to or unrelated to something like that, like a side effect, that is different. This is look at the English with disregard. Will you disregard a rash when you give any medication? You will not
No.
disregard.
Yes.
Okay. So the wording is a wording that makes the answer fever and not rash.
Yeah. Fever is the answer.
Okay. It was good I brought it anyway. But please next time have them for your answers, okay? Can you take us to the next question? Yeah. Great. Okay, this is the next question. Who is reading for us? Everybody's fed up.
I'll read.
Okay, read.
A
A child
client
with
with he's
Hey,
a client. But
hey,
yeah, I mean down.
hey. Read, you didn't read.
A child with
When someone was reading, you are reading. Okay,
ADHD.
read it.
Oh, forgive me. I mean down.
Okay. Oh, we are going again.
A
Who wants
child
to read
with
for us? An
ADHD.
educated reader.
A child with ADHD is prescribed methyl methylphenidate.
Little,
Which
little
instruction
it, yeah.
methylphenidate? Which instruction should the nurse give to the parent? A. Give medication at
Hmm?
bedtime. B. Monitor for weight loss. C. Give the medication with grape juice. And D. Expect increased appetite.
Who doesn't know this answer?
She's not here, or they are not here.
Who doesn't know this answer? The person is not here. So
Mm,
nobody knows it. So what's the
Yes.
answer?
the
B.
answer is
B.
B.
Okay, for this one, there no protest. Okay. Please, if you are here and you had this answer wrong in your head, please go and wash your face and come back to your screen. Okay. So yes, that's the answer. Our next question.
A client taking amphetamine should be monitored for which for serious adverse effect? A. Drowsiness. B. Bradycardia. C. Hypertension. D. Increased salivation.
Mm-hmm.
It's hypertension. Hey, Jesus.
C.
Choose your answer correct. So look at this question well. Mm-hmm.
Um,
What is your answer? Hey, still, so people are not sure. Okay, we are correct. Okay, it's hypertension. Hmm. It's hypertension. Okay,
yeah.
who doesn't know it's hypertension over here?
Mm.
Okay, if well understood, let's move on to the next question. Unless you have a question. Yes, the next question. This one, make sure you get it correct. Uh-huh.
Which condition is a contraindication for CNS stimulants? A. Diabetes mellitus. B. Glaucoma. C. Hypothyroidism. D. Iron deficiency anemia.
B.
B.
So
Glaucoma.
wait.
Boss,
This is select or that apply. I
boss,
didn't, I didn't bring. Yeah.
this one I beg. The last question, in fact, the hypertension, I don't really understand. Why hypertension? Because I thought the hypertension is one of its main, it causes hypertension rather, or
Oh, okay. So what is your answer to this question?
I was thinking the side effect may be bradycardia because drowsiness will be side effects. And
Hey,
so
my
since
brother.
Adverse
or
effects. Adverse, not side
This
effect.
one,
Adverse.
yes, adverse
Okay.
effect. Yes, adverse effects. I was thinking, but since it's a stimulant, the adverse effects maybe will be drowsiness
What
or
do stimulants do? What do stimulants do?
They
stimulant,
increase.
They
they
Ben,
stimulate
Ben,
you,
increase
Ben,
increase.
you see the rest of the class is beating you up.
because
yeah,
Oh,
but
stimulant is there.
I really need to understand this because
Okay, all right.
yeah, I was thinking
Okay.
I was thinking the side effects, the adverse effects of stimulants,
Mm-hmm.
drowsiness is part, or
Okay.
isn't it?
Okay.
Please, this one isn't it? The A, isn't it part? The
You
drowsiness.
want yes or no answer?
Yeah, I want
Yeah.
to know. I want to.
So
I want to know.
drowsiness.
Maybe if you watch the first lecture we had about downers and uppers, it will
Mm,
actually,
I think he wasn't in class. That's why. Or
yes,
maybe
I'm sure.
and he hasn't watched the video too. Yeah. Yeah.
yeah, no.
Yeah. So let me see an easy way. Maybe I can let you understand. But please, I think that meeting I made it intro, like pharmacology intro, so you can find it on your dashboard. Okay? Or when you go to our YouTube site, it's there. I reposted them last week.
Yes, I have.
So,
I have.
yeah, so you can go through them, okay. But one thing is that we said stimulants are apples, okay. When we say apples, it's like it's a term that we coin, like apples. It sends everything, like your vital signs. It sends everything up, up. Okay, that's why we've coined that term apples. So looking at your blood pressure, it will go up, heart rate will go up, everything will go up. So it moves in the action of sympathetic nervous action. In sympathetic nervous action, you have everything going up. Okay. So hypertension is there. Okay. So there is no way, you see, you can even have, for this person, you can even have nausea and vomiting. That is how the NCLEX is. The NCLEX can give you options. They will not
Can
give
even
you
have diarrhea.
yeah. The NCLEX can give you questions. Every answer. So for if you are new here, for people who are old here, I think they've realized this already. But if you are new here, take this. Note this and pay attention to it. The NCLEX will never give you like outright odd answers throughout. Every answer option will be correct. Should you search, every answer option will be correct. So even if you are getting you are getting wrong answers, or you are failing confidently. Okay, you will fail with confidence. And if you are passing to, you pass with
But
confidence.
that one is not our portion.
Oh yes, yeah, that is it. I'm just trying to explain a situation. Okay, so let's say if this question is select or that apply question, and you have nausea and vomiting, it's also part. You can have diarrhea, like abdominal upset or something. They are all
Yeah.
parts. Okay,
Yes.
you can have them, but which one is more targeted? If you know about the drug, you can easily get it. So even though you can have some options which are part, but amphetamines, because they are uppers, hypertension is the main concern. So that's one tricky part about how NCLEX answers their question. Okay, so
Now, I think even
um,
hypertension is
dra-
even
dra-
contraindicated.
yes, even drowsiness. I think drowsiness will even be a side effect of a downer rather, not an upper, because drowsiness is like it's bringing you down, everything is coming down. So it's likely to be a downer, like anxiolytics, okay, or antidepressants, Sorry, I said antidepressants, like anxiolytics, all my terms are gone, okay. But examples are like midazolam, diazepam, all those medications that can bring you down, you know, they can cause the drowsiness rather than amphetamine causing drowsiness. So it's hypertension.
What you are saying, yeah, we know the benzodiazepines and things,
Yes,
those you mentioned,
that was
they
what I
all
wanted
cause
to mention.
drowsiness.
Benzodiazepines. Yeah.
Yeah.
Mhm.
So they cause drowsiness, right?
Good.
So that is their
Because
effect.
it's a downer. They
Yes.
depress
So that
you.
is their effect.
Yeah.
Oh, okay.
Yeah.
So can I say bradycardia will be their adverse effect for the
So
benzodiazepines?
Benzodiazepines, yeah, bradycardia will be the adverse effect, or it can be even a side effect. The
Okay.
difference between adverse and side effect is that side effect is like, you can manage, and even though you don't like it, but you can manage. Adverse is like, it's
It's
causing,
expected.
yeah, it
It's
is
out.
causing a harm or danger. Okay, so
Okay.
they are all in the same category. So if you understand just simple things that we've just demonstrated here, then I will suggest you go and watch the first one. You will understand it very easy. We made it very simple with lots of examples. Okay,
Okay.
and that was the first thing we treated. It's not even in the middle of the video, so you can go back and watch. Any other question? Okay, so so the answer is hypertension. Appes will send everything up. Okay, and that's it. My reader. So I'm saying choose. I just want to modify this question. I want to test you.
It, you said it's
Um,
Satan.
this is select all that apply. Please, if you are new here, when you see SATA, it means select all that apply. Okay. So, what do you think would be the answer or the answers?
Contraindication. The
I
glaucoma.
go for glaucoma.
Yeah.
And then diabetes. I'll choose A and B.
You choose what?
A and B.
Yes, I'll just choose A
A
and B
and
because
B.
because it's hyperthyroidism, not hypo.
Eh,
So
eh.
it's AB.
Yeah, I'm playing safe, so I'll choose A and B.
Yes. If you say select all the above and I know only two, me, I'll go with two. AB. I won't add any other. I don't know iron deficiency.
Choose your answers right. Last option.
Okay,
Yeah,
Celia.
only B.
Starter can be just one option, so I'll just choose the B.
The B,
Since in
yes.
diabetes, we just monitor for blood glucose. It's not actually a contraindication, so I'll
Good,
just choose glaucoma.
good, good, good.
Me
So I
too. I'll
recently
go with him.
modified it
I
to
want to play safe. I'll play
yes,
safe too. I'll go for B.
yes. Okay, so when you remember when we were talking
But sir,
about
you said
stimulant and
select all the
diabetes.
above. Already we've answered the question we've answered the question that is B. And you brought in this that we should select all the above aside the glaucoma. What other else, right?
Yes,
That's
so
why
he was
we
Hey,
went
tricking you.
ahead.
hey,
Yeah.
please! I told you I'm modifying the question. So I'm
Oh,
adding select all that apply. So choose your answers, and you are choosing the A
so
and
I
B.
choose B.
Okay.
I've changed my mind. I'm choosing
Yes.
only B.
Yes.
Maybe I
So
chose B already. It's not like I've changed my mind. I chose B, but we're
all
not.
right. All right. So I did this just to draw your attention to something. Remember, we spoke about diabetes when we were talking about stimulant. It is not an outright contraindication. Stimulants can raise your blood glucose level up, okay, and it can also mask signs of what hypoglycemia. Okay, it can do both. So when you are taking stimulant and you are a diabetic patient, you should monitor your blood glucose level. Doesn't mean you can't take. If you have glaucoma, so Ben, the reason for choosing hypertension it is in line with this one. Stimulant causes high blood pressure. It can increase your blood pressure. So when you have glaucoma, you know, glaucoma most of the times systemic hypertension can, or let me say, it's one of the factors that gradually leads to glaucoma because when your whole system is having high blood pressure, like anything can happen. Any part of your body can be affected, even your ears. Okay, not even your eyes alone, your kidneys, your heart, your eyes. Okay, anywhere can be affected. So remember that these medications, they are systemic drugs, so they can affect your eyes too. So these medications are already elevating your heart, I mean your blood pressures, and you already have high blood pressure in the eyes. For me, I want to use the local layman term so that everybody here will not see this as a big medical term. Okay. Yes. So if you already have high blood pressure in the eye, battling with it, why should you add something that will rather also help increase your? Do you know that even Timolol, okay, Timolol,
Yeah.
if I don't know if I'm pronouncing it, right, Timolol and some other eye medication drugs, those beta blockers. Do you know that they have
Yes.
systemic effects?
Yes.
Even though you drop it on your eyes, but you know that they have systemic effects. Okay, so they are they all enter into your blood and they have their effect or they cause their action. Okay, so it is like stimulant to you take it in the body. I mean, you take it into your body. It raises your blood pressure. It affects the eyes. It makes glaucoma worse. Glaucoma, it's irreversible. When nerve cells die, they die. The medications are to it's meant to protect what is left. If you don't take good care of it and it also dies, it's gone. Nerve cells, optic nerve, they cannot replenish themselves. You know that. All right. I think this is also an easier one. So please, just to also let you know, select other apply questions can even be one question. Sorry, it can be one answer. So you can get 6 options and the answer can only be one. Please take note. Select other apply options in the main enclave. the answer can only be one, leaving all the other 5 answers wrong. And if you have 5 options or maybe 6 options, you can have all options to be correct, leaving none wrong. That's how the English is. So don't think select all that apply. You will have to fetch some and always leave some. It's not like that anymore. All right. Let's see our next question here.
Hello, sir. But as solving questions, I've never come across the select all that applies. That's just one question is
There are
right.
many questions like
Madam,
that.
Yeah.
I even did one yesterday and I had all
Uh-huh.
6 correct, and the other one I had only
There
1
are
out of
many
6.
questions.
Yeah.
Good.
Even during
Yes,
our normal question
yes,
session, we had such questions.
Good.
yes. There are
Good.
many. Even the questions on our dashboard, some of them are like that. So there are many.
Good. So that's how the main English is. Okay. Maybe if you've not come across any before, one day you come across some. But just to let you know. All right. Okay. Our next, Arida. Arida can take it for us.
Which finding indicates the medication is effective in a child taking a CNS stimulant for ADHD? A. Increased appetite. B. Increased attention span. C. Increased sleep. D. Increased weight.
Mm-hmm.
B.
The answer is B.
Yeah, the answer is B.
Answer is B. I also choose B.
All right. I hope you all understand, right? This is also not difficult. Is it difficult? So you see, when you get questions on this attention deficit hyperactive or disorder, or let's say anything about amphetamines or stimulants, they shouldn't be too difficult for you. Okay. For most of you, you've already seen the drug, especially those of you who have done pharmacology on dashboard, you've seen these things before. And even if you are new to this, at least this live class can even let you keep it in mind. It's very easy. Okay. You know, 3 main things that is used for. And remember the name. Okay. Finidate. We've learned 1 or 2 other drugs which can also treat the aspect of the narcolepsy and attention deficit also. Okay, we've looked at all of those things, but at least yes, I think when you see something like atomoxetine, that was what we did, right? Atomoxetine and clonidine, you know that at least they are not stimulants, but they can also be used to treat what attention deficit hyperactive disorder. I don't think that one is in the note we've given you on your dashboard. So at least it's an addition, right? And we have other forms. So questions on NCLEX regarding these areas, they are not too difficult. Just know the drug, know that it's an upper. Okay, it increases focus. I mean, it helps the attention or the attentiveness of whoever that is taking to get improved. It can get you to lose weight. You shouldn't take any stimulant when you are taking the drug, like coffee, chocolate, you know, all of that. They'll ask you questions around it. Should we get okay? And maybe when you should take it, ideal time to take it, And like the example I was trying to give you, they'll coin it in a nice way, as if that's the best answer. And always they make the good answer to look either neutral or worse. Okay. They make it look like neutral or worse. Unless maybe you know. If you know, then you can easily fish out the answer. But if you are not careful, you can be tricked. So stimulants, no one should get stimulant questions wrong. Okay. All right. Our next thing, we will finish with, we combine about three
Idea.
aspects of medications, of systems like skeletal system, neurological
Okay.
system, and something. Yeah. So we'll finish with them very soon. Then we move on to another system. Yes, sister.
Um. Please, I wanted to. I read somewhere that for the mesalfinidate, the one that they use for the ADH,
Yeah.
since it causes loss of appetite, it can be given after meals.
Yeah. So you remember I said most medications that do not mix with food, they are either given 1 hour before food or 2 hours after meals. So they are always like that. Okay. Before
Okay. Okay.
you eat is 1 hour, but after, if you've eaten, maybe you wait for 2 or more hours before you can take it.
Yeah, I want to clarify that because you said amphetamine is given 30 to 60 meals before food. So I
Yeah.
was yeah.
Oh yeah, that was what was in the note. But when I was explaining it, I made mention of the 2 hours after meals. I made mention of it.
Okay, thank you.
So it's also possible, and not only this one. Okay, for you can think about other medications that you don't have to give with food. They are always like that, like 1 hour before or 2 hours after. It doesn't mean that when you've eaten, you can never take the medication. It's impractical, okay? But if you want to take the medication, it should be maybe 2 hours after eating, at least. That should be the shortest possible time. Are we there?
Yeah, I understand. Thank you.
You're welcome. Okay, so we are coming to look at anti-Parkinsonian medications. Okay, anti-Parkinsonian medications. I know our time is up. Let me do a brief introduction on this one, then tomorrow we shall continue. Before you can appreciate this, um, I think you learned Parkinson's disease in when you were doing your neurology, right? I think it's in neurology, rather than
Yeah,
musculoskeletal.
that's it.
Yeah, that's where it is. So before you can appreciate how these drugs work, unless you understand what Parkinson's disease is, okay? When you hear of Parkinson's disease, think about dopamine, okay? Um, let's do this. Go and read more about Parkinson's disease. Then when we come back tomorrow, we'll make it very easy so that we can connect. Okay? So anti-Parkinsonian medications. Let's see if we can be fast about this. It is not too difficult and it's not lengthy. Okay, so before you um, get to know this, I just wanted you to um, remind yourself. Yeah, most of you have done this. Most of you who have completed neurology, I know you've done it. If you have not come across it yet, so Parkinson's disease, here is it. This picture is here to let you know some of the signs and symptoms, what goes on. Okay. Um, it's a neurodegenerative disease, right? That affects your movement and sometimes it can even affect your cognitive levels too. Okay, depending on the stage. So this is what you have here. Um, you have stoop posture. It's like they're leaning forward, right? That is stoop posture. Marked face, back rigidity. The elbow is flexed and wrist too. These are very, very, very tactical signs and symptoms. So if you get a case study question and they're asking you to take signs and symptoms, be careful so that you get them right. They'll give you options which are very related, even with the wrong answer. So you have to be careful. Look at it well and picture it. Okay. So they have this shuffling gait too. You know what shuffling gait means, right? They drag their feet when walking because they don't want to lose balance, right? So it's like they are dragging their feet to whilst walking in this posture. So this is how it looks like. Okay. So just to let you know. So we are going to look at medications which are used to treat these people. Anti-Parkinsonian diseases. Like anti-Parkinsonian medications rather. Okay. All right. So the disease we have shown you the picture, you have tremors. Okay. So as you see there, um there will be tremors, there will be rigidity. You saw the rigidity part. Okay, there's rigidity. There is slow movement. Okay, that's bradykinesia. There is postural instability. You saw that too, posture. So the treatment goal of this whole thing is that we want to increase the dopamine in the brain and decrease acetylcholine. So it's all about dopamine issues in the brain. When you hear of Parkinson's disease, it's all about dopamine issues in the brain. Okay. So when we increase the dopamine levels in the brain, we're going to have it well controlled. Okay. And we have to, in a way, because it's caused by imbalance of dopamine and acetylcholine, that normally causes these things to happen. You know, in a normal person, they are well balanced, right? But in Parkinson's disease, you have dopamine levels going down and acetylcholine coming up too much. So that is take Parkinson's disease in that way if you want to understand it. Okay, especially if you, even if you want to relate it to the medication aspect, take it as that. Okay, dopamine levels are down, plus acetylcholine is up, which causes this imbalance and all these signs and symptoms to happen. So if this is what is happening, then it means we have to give medications that will bring what? Look at the gold treatment. That will bring what? Dopamine levels up and what? Decrease acetylcholine levels. You see how easy it is to picture anti-Parkinsonian medication. So these are the main classes, okay? We have anticholinergics. You know, anticholinergics will help to do this. It will help to decrease acetylcholine release, okay? So anticholinergics will do that for us. Then the other medications will help maintain uh, dopamine levels to be high. So looking at all these one, two, you look at them later. 1, 2, 3, 4, 5. All these 5 medications down here, they all aim. Okay, all these 5 medications, they all aim to maintain higher levels of what? They do it in different ways. We look at that. They all aim to maintain dopamine levels up. Whereas anticholinergics brings acetylcholine down so that we can have an upper hand on the condition which is called Parkinson's disease for the person to get okay. All right. All right. So these are the classifications or the classes of the drugs that are used to treat Parkinson's disease. Okay. Any question on this one? Okay. Now let us look at the first one. Okay, so we're going to look at the first one according to how we have them here. So let's look at anticholinergics. I know most of you have heard about anticholinergics before. If you are here, you should know anticholinergics. It's one of the common drugs we have around. Okay, so upon popular request, at least you have examples first, right? You remember. So I have some here, all listed on the left hand side, and their uses. on the right hand side. Atropine, so at least you can look at the left hand side for examples. Okay. Atropine, you know what it's used for pre-op secretions and bradycardia. For Brady, it's very popular. It's very popular over here, okay, with atropine. It's very popular. That's what we use to treat bradycardia. And you know, atropine is also used to reduce secretions. When someone is drooling a lot, and even pre-operative secretions, you can use atropine. But you still have to look out for the person's heart rate. If the person is already giving heart rate of 120, you are careful to use atropine or any anticholinergics because all of these medications they raise your heart rate. All right. Even with hypertropium, that is mostly used by respiratory therapists and most nurses to nebulize. Okay, to help clear the airway. You are careful when heart rate is already elevated. Okay, you can have it being worse. Okay, so you look out for heart rate when giving this medication. We have scopolamine, which is also used for motion sickness. You've met the patch before in your books, right? And all of that. So it's also used for motion sickness. It's an anticholinergic drug. Hypertropium for COPD and asthma. It helps to clear the airway, to open up your airways. Tiotropium is also similar to open up the airway. And benztropine. So with regards to our Parkinson's disease, we're going to look at these medications a lot. Most of the times when it comes to English questions on especially anticholinergics used to treat these tremors in Parkinson's disease and the rest, you are likely to see benztropine. Okay, benztropine. When I was preparing for my English, I asked myself, why is it that they are interested in using benztropine to treat Parkinson's disease, like the tremors and all of that and that, but they don't like using atropine? Who can answer that? Why is it that most of the times the benztropine is preferred other than the atropine in the treatment of Parkinson's disease? Anyone
The
here?
bradycardia.
The bradycardia has done what?
I think because of the signs and symptoms of Parkinson, benztropine, I think, is used to
Benztropine
correct
can increase atropine.
One after the other. Someone
can
was
correct the
Mhm.
extrapyramidal effect of something similar to the Parkinson symptoms. So if you use
But
that,
atropine too can be the same because it's an anticholinergic. Atropine too can help. But why do we use the benztropine more? Atropine, benztropine. No. Okay, so the one main thing is the side effects. Okay, is a side effect.
Well,
Benztropine is preferred more because it reduces
Saliva.
level of atropine also reduces saliva. Okay, it reduces confusion levels, especially among adults. You know, Parkinson's disease it normally occurs in adults, right? I think above 60 years, right? Anyone who remembers the age, is it 60 years and above? Mostly,
Mostly 60 years and above.
yes, mostly 60 years and above. And when you use the atropine, you are likely to cause to have adverse effects happening. Okay, among people like that, they can get confusion, they can get this urinary retention. You look at other side effects and all of that under anticholinergic. So the side effects that comes with atropine when you are using in Parkinson's disease is like higher. That's why most of the time we prefer benztropine. Okay, so that's the reason. And we have the the trihexyphenidyl, right? Trihexyphenidyl. You have to hold your tongue well before you can mention it. Then we have oxybutynin. Okay, also for treating urinary urinary incontinence. Okay. Then tolterodine, also for urinary frequency. All right. So these are some of the examples. Now let's look at how they act. They block acetylcholine in the central nervous system. Okay. You know, the acetylcholine is it's a neurotransmitter. It's responsible for movement and all of that. So when you have them in excess, they cause that tremors. So this one blocks acetylcholine in the CNS and thereby help to reduce what tremors and involuntary movement. So that's how they behave. Side effects. Side effects. You remember, some people have some funny acronym. I can't pee. I can't poo. So I can't pee is urinary retention. That's how you can pee. You can't poo is constipation, right? And I can't drool. So I can't drool, I can't poo, I can't pee. Okay. You can't drool, that's dry mouth. You can't poo, that is constipation. You can't pee, that is urinary retention. So some people have these things to help remember these side effects. Then you're likely to get blurred vision and paralytic ileus. Okay, you know paralytic ileus and a GI, where you have um, the nerves in the small intestine being affected, and it causes constipation. It affects your peristaltic movement in the bowel. Okay, all right. So that is the action and the side effects. Contraindication: you don't have to use anticholinergics in well, narrow angle glaucoma. Okay, so glaucoma, be careful. Then myasthenia gravis. Why is it contraindicated in myasthenia gravis? Mm-hmm.
Because myasthenia gravis, I think they already have decreased acetylcholine, and then
Because my senior
Hey, someone was already on the floor. Uh-huh. As I think our sister was talking first before Franklin came in. So you can continue.
so since they already have a decreased acetylcholine, if you give them the anticholinergic, it's going to make it worse, I think.
Okay. Is that understood?
No, sir.
Hello?
No, sir. I
lead
don't get
to
it.
it may lead to myasthenia crisis in those patients.
Okay, so you explain to Franklin add up to what she said, or you can explain it in your terms. Uh-huh.
Oh, she has said it. So
Someone said she doesn't understand. So in a different way. Mhm.
So maybe you should explain the myasthenia in a bit and
Oh,
then add it.
okay. Okay. So our sister, are you here? What do you see in my
Yes,
senior
yes, sir.
graves? Some people are afraid of. What do you see in my senior graves?
This descending paralysis.
Yeah, so you have paralysis in like especially around your face and some other parts, right? Um, who can link it well for us?
Please, my
I think
small
there's an issue with the breakdown of
You see, you see something. Franklin will not talk when someone is talking. Then he will come in again. Franklin, you have
Yes,
30
baby.
seconds with me. You wait. I'll call you to add up, and when I call you, don't don't mute up. Just come up and explain, okay? But let our sister come in first because our sister started it. Uh-huh.
is my small understanding. I think
the myasthenia gravis, it affects swallowing and speaking, which causes muscle weakness. So if we give the anticholinergic, it will cause a lot of dryness. Because I know that in the myasthenia gravis, we give some medication to help them swallow. Which we give them the cholinergic medication, which will help them with the muscle weakness and other things. So if we give the anticholinergic, I think it will cause a lot of dryness or something. That's what I. Yeah.
Okay.
No, boss,
Yes.
boss. These
Yes.
topics usually confuse me, so I want to like tell you what I understand, so you correct me if I'm wrong. So myasthenia gravis is because of little acetylcholine. So the body does not have enough of it. So even in this condition, you give the patient acetylcholine. I think the drug starts from P or something. So
Pyridostomy.
and because of that, they have yes. So because of this condition, they usually have muscle weaknesses, maybe the face, the eyes, and all that. So this Parkinson's too, you are giving the patient anticholinergic is blocking acetylcholine. So if you give acetylcholine to a patient if you give anticholinergic to a patient block the acetylcholine, it will cause more complications. Please, am I right or wrong? Like you're supposed to give the patient acetylcholine in myasthenia gravis, but if you give a drug that will block it, you are complicating things for the patient. That's why they are saying it's contraindicated.
Okay.
So I would like to also add something small about this. So the myasthenia gravis is more or less like the autoimmune system has already produced antibiotics or antibodies. Sorry, that attacks what do you call it? The that breaks down the acetylcholine already. So already the acetylcholine, which helps in sorry, the and hey, why am I confused here again? So already there's antibodies which breaks down the acetylcholine. Please, I hope I'm not confusing you guys.
Are you continuing?
Okay, so it means there's autoimmune, production of antibodies, which already what this anticholinergic will do has already been happening. So if it is being added up again, then it means it is going to be really, negatively affecting the person.
Okay. So in my senior gravis, okay, you already have anticholinergic effect happening, right? Is that true or not? Let us take it instead. In my senior gravis, anticholinergic effect is already reduced. True or false?
Yes.
Sorry.
True.
Anticholinergic effect is in place. Okay, that is, you don't have lot of acetylcholine. Is it true or false?
True.
That's true.
We all agree to that, right?
Yes.
So when you give strong, let's say anticholinergics like benztropine, I'm using benztropine as an example. When you give it, you are making the myasthenia gravis worse. Okay, it will increase the fatigueness of the muscles. It will make you more weak, and it is likely to even cause your breathing muscles, okay, your respiratory muscles to even become weaker. Okay, but There are some that can be used. Okay, there are some that can be used. Can wait. What's the name of the drug? Pyridoxine. What's the class of pyridoxine?
Anticholinesterase.
It's a cholinergic.
Anticholinesterase. Is it
Unesterase.
Cholinergic.
What are
Cholinesterase.
you saying now? I just want to know which one. Okay, so all right, so that is all right, so let me even give you another example, like glycopyrrolate. Okay, it's also used to reduce secretion. Glycopyrrolate or even atropine. Over here, I think I have atropine here. So I don't have. Please, glycopyrrolate is also fat. Okay, we have lots of anticholinergic medication, so we can add glycopyrrolate. Okay, to it, and atropine, they can sometimes be used. Okay, um, to manage some of the symptoms. Okay, especially when you have how do we call it? When you have effect like excessive secretions. Remember, I said we can use
Cholinergic.
atropine here. Okay, atropine here to reduce secretions, and glycopyrrolate too. It's mainly used to reduce secretions. Those who are drooling and if maybe don't want secretions over, but they are used cautiously. All right. There are some of the anticholinergics you can't use it at all. Example is like benztropine. That is why. So I just brought it up so that you will know. Okay, you will know when maybe at a point in time someone is using atropine or glycopyrrolate to treat maybe secretions, excessive drooling or excessive secretions in myasthenia gravis. You can understand, but it's very like monitored. Okay, there are some you can't use it. That is why I think over here we are contraindicating it for all, but you can at least use it in moderation. All right. It's I don't know whether it's part of the next thing that we shall talk about, next two things or something like that. When we get there, you will know. Okay, and we can link it up. All right. Now, unless someone has any question over here, if not, we can continue. Anticholinergics. There are nursing considerations that you should know before you administer it. Remember, we are saying it is reducing your secretions. It is reducing. It's used to treat urinary incontinence and all of that. So you have to monitor intake and output so that you know if the person is retaining too much or not. Okay, and assess urinary retention. It's a side effect. So you have to note if the person is not retaining more than he or she should. You also have to look out for constipation. Okay. Then you have to assess mental status. Some of them can cause confusion, like the example I gave with atropine. Okay. So you have to monitor mental status. Then you have to monitor vital signs because they are likely to send your heart rate up. Okay. Anticholinergics are likely to raise up your heart rate. So, and yeah, I'm sure about heart rate, but I'm sure maybe some other vital signs can be elevated too. So you have to monitor your vital signs in all. Evaluate for decreased tremors. So as you are giving, you should also be looking at why you are giving it, whether symptoms are improving or not. Okay. All right. And additional teachings when you are taking medications as such, they should avoid driving. Okay, because you don't know how it's going to affect you. Okay, you don't know how the effect is going to be. All right. It reduces tremors. Okay, let me leave some aspects elsewhere. When we get there, we'll talk about it. Okay. Even there's a clue here that drowsiness may occur. So at least for now, it can even explain that it can help explain why we should avoid driving. Avoid alcohol, antihistamines, and over-the-counter cough medication. Okay. Most cough medications and antihistamines, they cause sedation. Most of them, especially with cough medication. Okay. They are like, they bring you down already. And if this medication can cause drowsiness, if you combine them, you are likely to get drowsy. Any question on this side? Okay. All right. If not, then so this is the first aspect. Okay. The anticholinergic aspect. Remember, I'm taking you back here so that you know here with the classes we spoke about anticholinergics first, and the next one talk about now is called dopamine replacement drug, which is levodopa. Okay. So if even if you forget about anything on diseases, sorry, drugs used to treat Parkinson's disease, remember anticholinergics to help bring down what acetylcholine levels that reduces tremors and all of that. That's the first aspect. And levodopa, this levodopa, whenever you remember Parkinson's disease, remember levodopa. It's like we are leveling up our dopamine levels, okay? Levodopa. You have to bring it up so that you can solve issues of Parkinson's disease. So that's what we're going to talk about it now. Okay. So it is most effective for the treatment of Parkinson's disease. Anyone with Parkinson's disease is on levodopa. Okay, it's like a synthetic form of the dopamine. Okay, so as soon as it gets into the body, it's being converted to dopamine in the brain. So it's like giving you dopamine itself. Okay. So like I said, don't ever forget the drug levodopa. Then we have carbidopa too. So carbidopa is mostly not used alone. Okay. It often combined with levodopa to treat Parkinson's disease and other related symptoms. Okay. All right. So just to let you know. All right. So I think it helps protect. So it's like do you know? Last time I was asking about a drug. Piperacillin tazobactam and amoxicillin clavulanate. Those are times those. I was asking a pharmacist. Okay, some time ago, was it around 2 years ago or so? Most of those drugs that have those combinations, they have one drug that protects. Let's say, let me use piperacillin tazobactam. Okay, as an example, peptides. The tazobactam is likely to protect the main drug, which is piperacillin. Okay, so that you won't have it being broken down before it starts producing its effects. Okay, so I think this amoxicillin clavulanate acid or something too. It has similar thing. So it's like this one too. Levodopa, carbidopa. The carbidopa helps maintain the levodopa level. It's like it prevents it from breaking down so that the levodopa can reach the brain undistracted. Okay. so that you can have the main concentration reaching the brain without being broken down before it even gets there. So that's how these combination drugs work. All right. Now administration. So you give after meals, okay? It's always given after meals. That is the ideal one. Then you give with low, please. This one, be careful. It's true. It's always like that, okay? With the protein parts, it's a tricky part you can be asked about. So you have to give with low protein snack. High protein will reduce the drug absorption. High protein so will reduce the absorption of level. All right. Any question on this one? The rest of the classifications, I've summarized it on this one. So we'll talk about it very soon. Any question here? All right. So we've talked about anticholinergics, right? We talked about anticholinergics. That was our first drug, which is used to treat Parkinson's disease, right? And our next one is the dopamine replacement one, which is levodopa. Talked about it. Then our next one is dopamine agonist. Okay. So when you watch here, you see we have dopamine replacement, which is levodopa. We talked about it. We have dopamine agonist. That's what we are going to talk about. Then these other three things. Okay. So with the miscellaneous, we have amantadine. We're going to talk about these ones. So with the dopamine agonist, we have examples. We have them here. Okay. We have pramipexole. Okay, ropinirole. Bromocriptine and ropinirole, they are common drugs. Ropinirole and bromocriptine. Yes. So they help do what? Stimulate dopamine receptors. So that's also how they function to increase dopamine levels. Remember, I told you with all the classes, we have anticholinergics, which is reducing the acetylcholine levels, and all the rest remaining has something to do with dopamine. So it's mainly dopamine and anticholinergics. These are the two main things. Okay, so that's how dopamine agonists. That's how they work. Okay, so just take note. Then we have should I say COMT inhibitors or COMT inhibitors? So it's an abbreviation for a long term. Okay, like the catechol O methyl transferase inhibitors. They are mostly shortened as COMT. And whenever you get it, you will see this one. Okay, there's no need for you to. But if you can keep it fine, that's catechol O methyl transferase inhibitors. So they also function to prevent the breakdown of what levodopa or dopamine levels. Okay, so these are some of the examples here. So, like I said, the rest have something to do with dopamine. Then we have monoamine oxidase B inhibitors. I don't know whether this is the first time people are hearing of monoamine oxidase B, but we have oxidase A. Okay, we know most people are conversant with monoamine oxidase inhibitors, just like that. So we have the A and the B. The A ones are likely to be used to treat depression. Okay, they are like they are used mainly for antidepressants. They are used mainly as antidepressants rather. So like phenelzine. Okay, phenelzine to be an example. It's an example of this monoamine oxidase inhibitors. But when it comes to the B part, they are mainly used to treat Parkinson's disease. Okay. monoamine oxidase B inhibitors. They are mainly used to treat Parkinson's disease. Example is the selegiline. This is an Enkel's favorite drug. It got to a time, we don't do this, but sometimes I'm careful in saying this. It got to a time people were seeing it a lot somewhere. Okay. So take note of this drug. And even if you don't get this and you get the rasagiline, you still have the gilling. Okay. But most of the time it is likely to be this drug that you see most of the time. So, I don't know. Someone will say selegiline. All right, then other class of drug that is used to treat this condition is amantadine. Okay, and what amantadine does is also to promote dopamine release. Look at this well. And if you have any question here, you can ask. If not, let's look at the side effects of the dopamine. We looked at side effects of the anticholinergics, right? Now, we are going to look at side effects of dopamine drugs. So dopamine drugs also can cause dry mouth, okay, nausea and vomiting, constipation, orthostatic hypotension. Let me clean my board here. Cardiac dysrhythmias, then sleep disturbance, okay. And it can also cause on-off phenomenon. When we say on-off phenomenon, it's mainly peculiar with Parkinson's disease. Who has said it? Who has said of it before this class? People who have been on levodopa, or yes, let me say that people who have been on levodopa for a very long time. No one has said of it before, right? So that is on-off phenomenon. So what happens is that at a point in time, they will have, the medication will be working. Okay, they will have a good form of movement. Okay, everything will be fine. And there will be a time they will have the off. So we're having good time working, the medication is working. That is the on period. Okay. Then when the off period happens, that is where you see this tremors and muscle stiffness and all of that, the bradykinesia, the slow movements, all of them setting in again. So it's like they come on and off. So whenever you hear on off phenomenon, it's peculiar to Parkinson's disease, okay? Especially for, like I was saying, for those who have taken levodopa for a very long time. The on is when everything is on point, like they have good mobility. But with the off phenomenon, that is where you have symptoms reoccurring or resurfacing. We have involuntary movement, that is dyskinesia, as side effect of dopamine drugs. And we also have depression. Okay. All right. When someone takes levodopa for a very long time, and or not necessarily long time, okay, but how you can see if they're having levodopa toxicity, they will twitch and they will have facial grimacing, okay, they will have tongue protrusion and mental changes. So when they ask you which of the following are side effects, or maybe a person is taking levodopa, okay, what sign, or among which signs and symptoms will you report, okay, as levodopa toxicity? So if you see tongue protrusion, grimacing, twitching, or mental status change, then you should know that the levodopa is in its toxic levels. Okay. All right. Now, nursing consideration when giving this medication. One, you have to monitor blood pressure for orthostatic hypotension. Okay. You also have to monitor respiration. You assess mental status and depression. Monitor for involuntary movement. Assess tremors, gait, and rigidity. That's how you know whether it's working or not. The drug. Then decreased tremors too. You have to monitor for that. Then you have to also notice if there's any improvement so that you can report accordingly to the healthcare provider. Any question here? Okay. So, what's your?
Yes, sir. I had my
Mhm.
hand up.
Oh, sorry, I didn't see.
Yeah,
Okay.
I wanted to find out with the levodopa toxicity, is that do you have to draw blood, or how do you find out the therapeutic range? Do you have to do that, or you
Um,
just guess with the signs and symptoms?
I have not seen in anywhere yet that we do serum. We draw serum levels of that. It's impossible. I haven't seen it anywhere. Like how we have for vancomycin and um, phenytoin, digoxin, and I've not seen that for levodopa. So maybe the toxic levels, like if you see the sign, if anyone here too has seen it before, the person can share with us. But I have not seen it anywhere yet. The world is big, and um, we have knowledge, like knowledge being endless. So I don't want to say we don't have. Okay, yeah, it could be that we don't have. It could be that we have, but I have not seen. I've not seen that yet anywhere. Has anyone seen it somewhere that we draw levels of levodopa before maybe we give the next? All right, I don't think there's anything like that.
Okay, thank you, sir.
You are welcome. Now let's look at something here. Some food interactions, okay? When you are taking levodopa, some food interaction. The first one here we have levodopa. So when we've thought about this already, when you are taking levodopa, you have to what? Reduce um you have to reduce high protein intake, okay, because it reduces absorption. Okay. High protein intake reduces absorption. So that is what you have to take note. And the next one here, there's selegiline or selegiline. Okay. Which is a monoamide oxidation. Please, for theramine containing foods, theramine is a kind of protein found in certain foods, okay, which makes hypertension or which makes blood pressure go very, very high. All right. So this theramine containing foods, which is likely to lead to hypertension with monoamine oxidase B inhibitors. It's the same thing for all the other ones, okay, like monoamine oxidase A inhibitors. So not only for this one, it's for all monoamine oxidase inhibitors. When you're taking them, I think that one is mental health drugs. Like, yeah, when we get there, you look at them. So ceramide containing foods, when you're taking any monoamine oxidase inhibitor, you don't. So not only this one, just to let you know. All right. So that is it. I've told you this one is just a protein in food that makes you get hypertension. Like it makes blood pressure go extremely high when you are taking this MOE. All right. let's look at some of the examples of those foods. Okay. So in questions, there will be like 8 cheeses. Sometimes they can even give you a food that contains 8 cheeses.
Yeah, why?
Okay. Are you asking a question? Okay. So like cheddar, Swiss, blue cheeses, they all contain 8 cheeses, so you can't take it when taking monoamine base inhibitors. Then this one, do we pronounce it as cured or cured? How do you pronounce this word? It's like pureed. When you are giving people who have difficulty swallowing, when you are giving them food, the kind of
Pure. Pure.
that one is pureed. So this one will be cured, right? Cured or
No, said
smoked
yeah,
meat.
cured. Like when we say like more money, it's cured something something.
Oh,
This
so
is
that is
cured.
cured. Oh, so that is
Oh,
cured.
that
Okay.
is pure.
Well, I don't know whether you mentioned it as cured or cured, but fine. Cured. Let's say cured or smoked meat. Okay. An example is salami, pepperoni, and sausages. Please, they are high in theramine. You don't have to take them when you are taking monoamine ovulation. So take note of the foods, okay, and all fermented foods. Over here, they don't take banku, so you not see banku in the options. Okay, yes, but you can see something like soy sauce and this. I don't know how you pronounce it, but just take note of it, capture it in your like vision it, visualize it there, have the I don't know, have the screenshots in mind so that whenever you see them, you can be able to pick them out. Beer, okay, anything alcohol. So sometimes when they say beer, you could catch them when they want to trick you. So they'll sometimes say red wine, or even when they say wine, be careful. Okay, don't go in for it. Even when they say just wine. Then protein foods like liver and pickled fish. They are also high in theramine. And some fruits like overripe banana, overripe I think avocado tastes bad, but overripe banana. Okay. But the overripe, I saw it somewhere that even a lot of overripe fruits, they also contain theramine, like not only bananas, a lot of overripe fruits, they contain theramine. So you have to be careful with the overripe things too. Then we have others like yeast extracts, liver beans. Yeah. So when you're taking MOABs, these inhibitors, you should not take this food because they will make your blood pressure go extremely high. Okay. Any question on the previous slide before we carry on? If not, what you teach clients, they cause orthostatic hypotension. So when they are changing position, they have to do it slowly. When you see twitching, remember toxicity or overdose. When you see twitching or any spasm around the eyes or anywhere, let them report. And do not stop medication abruptly. It can lead to what? You those who have eyes have seen it, right? You see it somewhere again. Avoid high protein meals with levodopa. Okay. So if you like eating more protein, please. When you're taking levodopa, when you take high proteins, what will happen?
It would reduce the absorption, the drug absorption.
Absorption. Good. And you have to take medications exactly as you are prescribed. Okay. All right. Any question here? If not, I have questions for you. So ask your question before I ask you mine. Even if you forget about anything at all, these things, don't forget about them. Okay? That levodopa is like a synthetic form of dopamine. Okay? You combine it with the carbidopa to help maintain its levels so that can have it unaffected when it gets to the brain. Okay, so levodopa, that's the most effective Parkinson's drug. And we're also saying when you take in high proteins, it reduces levodopa absorption. We also establish that fact, okay? Orthostatic hypotension can happen. So you have to medicate patient to change position slowly. We spoke about the off and on or on and off phenomenon, okay? Phenomenon, which is sudden loss of effect. So the on is when you have the cool effect. I mean, everything is going on well. No shuffling gait, no tremors, and all of that. And the off phenomenon is when you have symptoms returning. Okay. Then the next one we are saying, do not stop your medications abruptly because it can lead to what?
Parkinsonian crisis.
And when you see twitching, facial grimacing, all of those irregular movements, it could mean, especially if the patient is taking levodopa, it could mean levodopa toxicity. All right. So at least even if you forget about anything, don't forget about these things on the dopamine side. We've talked about the anticholinergic side, so I think that is okay. Any question?
The league is competitive team. The national team is ours. The league is competitive. How's no competitive?
Yes, please. My
If no
hand has been
question,
on.
then
Yeah, boss,
I
please. My hand has
have
been
questions
on.
for you.
I have a question. Hello.
So for you, after that,
Hello.
you talk, okay? Hello. Can you hear us?
Yes. Can you hear me?
Someone was
Hello.
saying hello. Are you here?
Yes. Can
Yes,
you
please.
also
You can
hear?
talk. Yes,
Uh-huh.
I can hear you
Please.
now. Mhm.
Good. Please, I wanted to ask you, the on and off phenomenon, does it have anything to do with the patient not abiding uh, by the treatment regime, or it just happens like that? Is it that the patient sometimes was not able to take the medication, or I want to understand what is
Sorry,
the or the
part of the line was breaking. I don't know whether it's from my end or I didn't hear you well. Can you come again?
hello?
Can you hear me?
Yes, I
I didn't
can
hear
hear.
part
You
of
can't
what you
hear
said.
me.
So if you can repeat, I can hear you now. So if you can repeat your question, please.
Okay, I was asking the on and off phenomenon. Does it have anything to do with patients not adhering to the treatment regime?
For which one? I heard, is it not related to patients not adhering to treatment
Yes,
regime?
the
I
on
didn't
and
hear the
off.
first part. So which one are you
Yes,
asking about?
please,
She's
is the
asking
on
about
and
the
off.
for
Yes,
On and off phenomenon.
yes,
yes.
please.
Okay, so yes. So we said, yeah, I can hear you now. So we are saying the on and off phenomenon, it happens when people have taken the medication for a very long time. So they are taking it even though, but it's a side effect, like something that happens with levodopa. Have I answered
Okay.
you?
Yeah, okay, thank you. Okay.
All right. And I think someone's hand was up. There was another lady. I hear before Franklin.
Please, am I the only one? Seems like
Okay.
I cannot hear Bosu. The network.
Okay.
We can hear
Okay,
you.
I can hear you.
I hear you.
Okay. All right. Franklin. That's what I was saying. Franklin, you can talk,
Okay.
okay?
Please, I want to ask. Mostly, they combine the carbidopa with levodopa
Yeah,
for
the
these
Kabidopa.
patients.
Yes.
Yes, I want to find out with the protein restriction. In the case that we have a combination of carbidopa and levodopa, do you still restrict protein for the patients?
As long as what you are taking contains level just to help guide and concentrate the levodopa levels. So why would you even risk taking high protein? Do you want to chew liver? You want to chew big meat? Why would you even risk it? So it is contraindicated. I mean, it is not advisable. You can't take. Otherwise, you are taking the drug, but it will not have. I mean, it will not give you its desired effect because absorption will be impaired. Okay.
Okay.
Any other question? Okay. If not, then I have questions for you before we go. Okay. So I have lots of things for you here just to let you keep things. Okay. Parkinson's disease means what? You have low dopamine. So what do? You have to give dopamine. And acetylcholine makes the tremors and all those signs and symptoms worse. So what do? You block acetylcholine. And once you are doing all of these things, you have to watch orthostatic hypotension. When they are changing positions, you have to educate them to do it slowly. And once you are giving all of these things, you have to watch forward twitching. Okay, dyskinesia. If the levodopa is in toxic levels, you have to monitor and report. Is it not simple and concise? Is it not?
Yes.
It is.
Yes.
It is. Thank you.
Yes. All right. All right. So now you can picture Parkinson's disease and you can treat it. You can at least understand at your nursing level how to deal with it, right? Idrusu, you want to ask a question? I hear some voices at the back. I don't know whether they are talking to us or they are talking. So if you have any question, kindly raise up your hand so that I can see you. Okay. All right.
I want to raise my hand, but I
If
don't
there
have.
are no questions, then I have questions for you. Roberta, you have a question?
Yes, but I can't raise my hands. Please, I forgot about what we used to block the
Oh,
acid.
okay.
What do
Oh,
we use to block
anticholinergics.
the Okay, okay, all right, thank you.
Yes, and you are likely to see benchtroping when it comes to Parkinson's disease. They normally use the benchtroping a lot. Okay.
Okay, all right,
All right.
okay.
Any
Thank
other question? You're welcome. All right. If not, can I get a reader? These are very, very easy questions, except I just reserved some two questions that will make you think before, it will make you think a bit far before you can answer, but these ones are easy.
Hello,
Let
sir.
us do these questions. Okay, let us finish with these questions before we go. I know it's 11 already. Sorry, it's
It's 2.
time already. But let us finish with all our questions on this before we go. All right. It's 2 at your side. It's 6 somewhere. I know the time differences. But let us finish. Try and give me your time. Let us finish with this before we go. Someone wanted to ask a question. Oh, for you, mm-hmm.
Please, mine is not
No,
a
no,
question.
no. I'm not the one who wants to
Oh,
ask
okay.
the question.
It's a
All right.
concern. Please, I joined
Yeah,
the
you can
class
ask.
yesterday. Please, can you hear me?
Yeah, please, we can
Hello?
hear you.
Yes, I can hear
Yes.
you.
So I joined the class just yesterday. And by my realization, I can see that you are far ahead of me. So I want to ask, how do I cover up? Like,
Okay.
do you get
Okay,
it?
yeah. So it's a good question.
Yes.
For all those who joined not long ago, what we do is that our live class is different from what you have been given on your dashboard. Okay, your main work is the one that you're doing on your dashboard. What we do in live class, we handpick topics all over. Okay, we pick them from all over, and we don't have a peculiar timetable. Sometimes we bring topics as and when needed. When certain areas are more pronounced on the English word, or let me say in the English word. I will not go into detail about that. Okay. But when certain topics are more pronounced in the English word, we sniff around and we bring those areas on, like we bring those areas on board and we teach them in live class. Okay. That's why we can't have a particular timetable for it. I mean, maybe after this we will treat this. We announce it to you as and when necessary. And at times we bring topics which are unlikely for you to understand on your own should you learn it. Okay, we bring those areas to life class. Like not long ago we did EKGs, dosage calculations and the rest. Yeah. So those are the things combined that influences our topics. Life class. Yeah, so those of you who joined us um, and did not start with pharmacology with us, yesterday I told you I would we've not gone too far, okay. Even though what we've done, I've put them on your dashboard. So when you get to pharmacology, you get to go through it. But after I'll repost it. I'll repost what we've done so far, okay, in the
All right.
masterclass page so that you can pick up, okay.
Okay.
By next week you should be able to pick up. Okay. I think we've already done 2 parts. Like apart from we did one intro, then we've done 2 parts. So just 3 videos, right? You can go through before next week, then you can catch up. They are very interesting. Okay.
All right then. Thank you.
All right. You're welcome. Can I get a reader? Mm-hmm.
Yeah.
Okay, so I'll read.
Okay.
A client is prescribed levodopa, which statement indicates a need for further teaching. A. I will take this medication with a high protein meal. B. I will change positions slowly. C. I will report unusual movements. D. I will not stop this medication abruptly.
What's the answer? Please try and answer some.
The answer is A.
Mm-hmm.
A.
Someone is
The
saying
answer
A, someone is saying B.
is A.
Okay. All right. Why A?
Because when you take it reduces the
Absorption
more
of
of
the
high protein,
levodopa.
decreases absorption of the medication.
So yes, the answer is A. Okay. High protein pulls decrease levodopa absorption. So that is true. I hope everybody understands. This one is easy. The next one. Mm-hmm. Is my reader here? My reader.
A client is prescribed.
Another person can be.
A
Go
client.
ahead.
A client is prescribed menstrual pain. Which side effects should the nurse monitor for? A. Diarrhea. B. Urinary retention. C. Hypoglycemia. And D. Bradycardia.
B.
Mm-hmm. Are we all
Urinary
choosing?
retention.
What are we choosing? B?
B.
Good. You remember, I can't drool, I can't pee, I can't poo.
Yes, I can go.
Okay, so that is true. All right. If you don't understand anything, you can draw attention. Okay. The next one. Mm-hmm. Hey, my reader.
Which condition is a contraindication for menstrual pain? A. Diabetes mellitus. B. Narrow-angled glaucoma. C.
B.
Hypertension. D.
The
Hypertension.
answer is B.
So what's the answer?
B.
Glaucoma.
Okay. The answer is B. This one too is easy peasy, right? Okay. That is good. The next one. If you were with us from the beginning of this class, you should be able to get all these questions correct. You know that. Let's go.
What is the most serious risk if anti-Parkinsonian drugs are stopped suddenly? A.
B.
Yes. B. Parkinsonian crisis. C.
Parkinsonian crisis.
Hypertension. And then D. kidney
Parkinsonian
failure.
crisis.
You see how you're answering this frequently or fluently. Do that for all the questions, okay? All right, yes. So you shouldn't stop it abruptly. Otherwise, you can cause what? Parkinsonian crisis. Okay. So this is how you see the Parkinsonian crisis: severe rigidity, and you see severe forms of what is happening. Okay. So watch out. That's how you learn. When you see Parkinsonian crisis, ask yourself, what do you see in Parkinsonian crisis? So these are some of the things you see. Okay. All right. Is this person talking to us? I hear some background voice. Oh, okay. All right. The next question.
A client on anti-Parkinsonian therapy develops irregular heart rhythm. What should the nurse do first? A. Document the finding. B. Reassure the client. C. Notify the healthcare provider. And D. Administer next dose.
Notify.
Okay. So this reminds me, yesterday someone was asking me what questions, like, she wanted to know questions that normally the answers are notified. You know, I'll look into it, and when I find something more concise, okay. There are some of the English questions, you either do something before you notify, you don't just notify. Apart from assessment aspect, okay. So I'll look into it, and when I get something nice, I'll present it in class. So yes, for this one, it's an example. When you have irregular heart rhythm, you can't, with your own permission as a nurse, you can't do anything. You can't go ahead and give drugs without prescription. So you will have to let your healthcare provider know before. Okay. So yes, that is C. All right. The next question. So this is one of my tricky. I think my tricky questions are as follows. Maybe 2 or 3. Let's go.
The nurse is assessing a client with Parkinson's disease to determine the effectiveness of medication therapy. The nurse would determine that the medication is not working optimally if the client is demonstrating which characteristic? A. A flattened effect. B. 2. Tonic-clonic seizures. 3. Decreased intelligence. And 4. Changes in pain tolerance.
Okay, so what's the answer?
Three.
You see,
Because
you
them
see
are
this
not
one. This one, many
science.
people are quiet. You see.
One.
No, sir. I'll go for number one because I
Mm-hmm.
don't
Yeah,
three,
one.
2, 2, 3, 4 are not science. I mean, they are not related to Parkinson. So
Like seriously?
One.
Okay,
I think so,
Franklin.
one. I don't know.
Franklin, what will be your answer?
Okay.
We are waiting for you, Franklin. Choose your answer and let's see. Are you now
I'll
ready?
go for 3.
You go for 3.
Yes.
Okay, so let us clap for Franklin, because according
Hey.
to Franklin, he learned that Parkinson's disease affects our intelligence. Okay, so let us clap for Franklin. He has done well.
No.
Okay, Franklin, clap for yourself. Okay.
We should say like seriously to you right now.
Boss, even though I'm not okay, even though I'm not also uh arguing about the A, but the intelligence too does links to Parkinson's diseases, because I remember something about it decreases or it affects
You
memory
see, cognitive,
and thinking.
yes, cognitive function, it affects memory, yeah, cognitive function. But
Okay.
please, intelligence is something else. Okay.
Okay. Okay.
Intelligence, I read
Okay,
it
what I
somewhere, they
also
can
know
learn
is
new
that
skills, but
when
they have
when they
memory problem.
but
Okay, they have
here,
memory problem. Yeah.
what I also know is that when they are taking this medication, you should expect an improvement in their memory. That's what also.
Good. Good. Okay. And another thing is that they can learn new skills, even though very slowly, but they tend to forget. That's why you always have to keep on reminding them.
Oh, if
This is
you.
different from Alzheimer's disease. Okay. Alzheimer's disease is very serious because you have those dementia can happen. But this one, it's a bit different. So please, it's a flattened effect. Okay. Are we there?
Yes.
Yes.
Yeah.
Okay. Take our next question for us. We'll go right now. Okay. Uh-huh. Someone has a question.
Yes.
Please, can you
Increase
go back to the previous question?
causes one seizure.
I
The
hear
question itself.
someone talking. Is the person talking to us?
The question itself. Okay, thank you.
You're welcome. I heard someone talking. Is the person talking to us?
Yeah.
A very small female voice.
Yeah. I also thought she was going to ask a question.
She was reading the question.
Oh,
Read the
okay.
question.
Mhm. No question, right? Okay, let's carry on. Who
The
is reading?
client with Parkinson's disease asks the nurse, how will levodopa treat this disease? What action of levodopa should the nurse incorporate into a response? 1. Improves myelination of neurons. 2. Increases acetylcholine production. 3. Replaces dopamine in the brain cells. 4.
3.
Causes regeneration
What's
of
the answer?
injured
3.
organ cells.
Dopamine.
3.
3. Oh.
This
3.
is also easy to spot, right? Okay. So yes, that is 3. Okay. Remember we said their dopamine levels are down, and we give the medication to replace. All right. I think maybe this will be our last question, then we can go. Someone should take it for us.
Levodopa is prescribed for a client with Parkinson's disease. What information should the nurse include in the teaching plan for the client about levodopa? 1. It is poorly absorbed if given with meds. 2. It must be monitored by weekly laboratory tests. 3. It causes an initial euphoria followed by depression. 4. It can cause a side effect of orthostatic hypotension.
Oh.
The answer is 4.
Okay. Okay. We have done very, very, very well. Yes. So the answer is 4. Okay. The answer is 4. The next time we meet, we're going to talk about